Democracy Now!, democracynow.org, The War and Peace Report. I'm Juan Gonzalez. The Japanese nuclear crisis continues to worsen as authorities race to cool the overheating reactors at the Fukushima Daiichi plant. Earlier today, Japan raised the nuclear alert level at the crippled plant from a 4 to a 5, which is on a par with 3 Mile Island. Japan's Prime Minister Naoto Kan described the situation as, quote, still very grave. Japan is continuing to dump water on the reactors while attempting to fix a power cable that could help restart the water pumps needed to cool the overheating nuclear fuel rods. But Gregory Yasko, the chair of the U.S. Nuclear Regulatory Commission, said Thursday that it could take weeks for the crisis to be brought under control. Meanwhile, the number of dead and missing from last week's devastating earthquake and tsunami has now topped 16,000. It is the deadliest natural disaster to hit Japan in nearly a century. 2,200 emergency shelters are operating in the disaster zone, but many are running out of food, fuel, water, and medicine. The organization Save the Children estimates 100,000 children have been left homeless. To talk more about the crisis in Japan, we're joined by Philip White of the Citizens Nuclear Information Center in Tokyo, Japan. Also with us is Dr. Ira Helfand of Physicians for Social Responsibility and longtime nuclear critic Ralph Nader, author of the recent book, Only the Super Rich Can Save Us. I want to begin with Philip White in Tokyo. Your sense of this latest announcement by the Japanese government that it's raising the level of the emergency and what you're seeing from Tokyo.
I think it's a good indication of how they are underestimating the seriousness of the problem. Our experts think that it's a level 6.5 already, and it's on the way to a 7, which was Chernobyl. It's actually, we're shocked that they have only called it a 5.
And why do you? What makes you think that the level is still being so grossly underestimated?
Well, you have so much radiation is already out. Radioactivity is already out there. You have spent fuel pools in at least two of the reactors that are burning and exploding and things like that. You've got a hole in another reactor. In the containment vessel, you've got 6 reactors lined up there, ready to go off any minute, and they think that's a 5. I'm not quite sure what they're thinking about, really.
Well, we've begun to get some of the actual levels of radiation that have been measured. The helicopters, for instance, that flew over some of the reactors yesterday, trying to dump water on them, measured supposedly, according to the Japanese government, at levels of 300 meters above the reactors, about 4 millisieverts of radiation per hour, and then at 100 meters, which is where they descended to, 87 millisieverts per hour. Could you tell us what that means in layman's terms for those who don't know the levels of radiation measurement?
Millisieverts, so that's 1,000 of those makes up 1 sievert, and 1 sievert is well and truly into the high dose of radiation, and you're getting acute radiation symptoms well below that. But when you're counting millisieverts, you've got to remember this is per hour. So people who are actually there for any length of time, you multiply that figure by the number of hours they're there. So people who are actually in the plant, although they will have protective clothing, they are getting massive doses of radiation by now. People off the site, we've seen figures in the around 170 millisieverts per hour at 170 microsieverts per hour at about 30 kilometres. The microsieverts, it's a much smaller figure, but those people are potentially there for quite a long time, and if they were outside, which hopefully they're not, they would be getting the average yearly dose in about a day or less, or maybe 10 hours or something like that. So just think of that. In one day, you can get your average daily dose of radiation if you go out 30 kilometres from this site.
We're also joined by Ira Helfand of Physicians for Social Responsibility. Your assessment of the about the dangers of the radiation in the exclusion zone to the workers and the potential for other areas outside the exclusion zone.
Yeah, I mean, there are basically two distinct dangers that we face with the reactor accident of this sort. One is the levels of very high radiation, which are primarily confined to the area right around the plant, at least at this point. And these are doses which, if you get up to a full sievert, will cause, as Phil was just explaining, radiation sickness. This is primarily a concern for people working in the plant, the 180 some odd workers who have stayed behind there to try to bring the situation under control. If there was a much larger release, this conceivably could be a problem further out, but hopefully would not go out beyond the evacuation zone. I think the danger, though, that we need to focus on, because it's the one that affects the largest numbers of people, is the danger posed by low-level radiation and the possibility of cancer and other chronic illnesses being caused down the road from this episode. The radioactive material coming out of the plant is made up of about 200 different radioactive isotopes, and particles of these radioactive materials can travel great distances with the wind if they are dispersed into the air. We're picking up radiation as, elevated levels of radiation in Tokyo and in other places at some remove. At this point, those levels are still quite low. And while it is important to emphasize that there is no safe level of radiation, any radiation exposure increases your risk of cancer. The levels that people are being exposed to at this point remain quite low if you get away from the plant itself, and will have very low health effects. If there's a larger release from this plant and the situation there is still completely out of control, that could change very dramatically. And we could end up with a situation, as occurred at Chernobyl, where significant amounts of these radioactive isotopes get deposited downwind, contaminating populations, exposing them to an increased risk of cancer. And the best estimate that I've seen is that there will be approximately 250,000 excess cancer deaths ultimately as a result of the Chernobyl accident. We could have the same kind of wide deposition of radioactive materials if there's a much larger release than has occurred so far. In addition, large areas of ground can become so contaminated that people can't use these areas for extended periods of time. And again, the Chernobyl experience, there are areas up to 100 miles downwind from the plant that had to be evacuated and which remain unsafe for human use today. So these two distinct dangers, the high doses of radiation affecting primarily people right around the plant at this point, and then the potential for a fairly broad distribution of low-level radiation, which could be quite destructive from a public health point of view.
And your sense of the differences that have emerged between the U.S. government's assessment of the problem and the Japanese government at this stage?
Well, I think it's very hard to figure out what's going on for sure, and I think both the U.S. and the Japanese governments are working somewhat in the dark here, and so it's kind of hard to know whose assessment is right. But I think that what you're seeing on the part of the Japanese is that one might perhaps wish to evacuate up to 50 miles, as the U.S. government has suggested should be done. I'm not sure how you do that in a situation where the area has been devastated by an earthquake and a tsunami. I think from my point of view, the most important aspect of the U.S. government recommendation of a 50-mile evacuation zone applies not just to the situation here in Japan right now, but to potential future situations in the United States. The primary danger to American citizens at the moment is not from radiation emanating from the plant in Japan. It's the potential future release of radiation if we have an accident like this in the United States. And for example, the nuclear plant in the U.S., which has been said to be most vulnerable to earthquake activity, is not, as I had expected, in California. It's Indian Point, 27 miles north of New York City. If there were to be the kind of release at Indian Point that we are seeing now at Fukushima, a 50-mile evacuation zone involves the entire New York metropolitan area. And I'm not sure quite how we would evacuate the 20 million people who live in that metropolitan area or where we would put them.